Did you know there's an FDA-approved breakthrough treatment for depression that works completely differently from SSRIs? It's called Spravato, also known as esketamine. It's produced by Johnson & Johnson as a nasal spray, gets administered in specially licensed clinics. It lifts treatment-resistant depression and suicidality in days, not weeks. And today, in this video, I'm going to explain how we maximize the amount of time that these benefits last for. I'll talk about the different dosing options for Spravato, especially when it needs to be taken twice a week, once a week, or every 2 weeks, or when do you actually stop. By the end, you'll know exactly what the research data shows, as well as hearing about the real-world clinical experiences of actual patients that use Spravato. So if you're thinking about using Spravato yourself, this video will tell you exactly what to expect in a typical patient journey. Before I dive into that, quick heads up that we here at Marpa Minds are a next-generation mental health clinic offering breakthrough depression treatments like Spravato and ketamine therapy. Check us out at marpaminds.com. Spravato is very well researched. Its clinical trials included 35,000 adults that had treatment-resistant depression. They were monitored for safety and efficacy for a total of 8 weeks. The data from these trials can roughly be structured into two main phases of when the people were using Spravato: the induction phase at the beginning and then the maintenance phase afterwards. Induction phase usually lasts for around 4 weeks, and then patients receive Spravato twice a week during that stage. The first dose on day 1 is 56 milligrams of Spravato, the lower of the two dosage, and then afterwards, if everything's looking good, gets increased to 84 milligrams a dose. As patients continue receiving their treatment twice a week, the depression scores are measured using very well-proven assessment scales, and the most common one is called the Montgomery-Åsberg Depression Rating Scale, MADRS, and it's got 10 questions. Each one is rated according to either 0 or 6, a scale. So 10 times 6 is 60. That would be the absolute maximum score the most depressed human being in the world could possibly get, 60 out of 60. So during this 4-week induction phase, what we're aiming for is patients to have their depression score fall by 50% compared to when they first arrived. Once a patient's depression score reduces by 50%, they then move into the maintenance phase of Spravato treatment. Typically, this maintenance phase starts between weeks 5 and weeks 8, and it continues with weekly dosage of Spravato. And then maybe from week 9 onwards, if the depression score stays low, things are looking really good, patients can taper down again, so they get Spravato every 2 weeks. And normally this would happen once their MADRS scale goes to lower than 12 out of 60. And I'm going to summarize that. Patients start Spravato with 2 treatments a week for the first 4 weeks. Then weeks 5 to 8, they have Spravato once a week, and potentially moving to 1 treatment every 2 weeks from week 9 onwards. It's important to mention here that dosing frequency is always going to be individualized, so patients take the lowest amount possible. We always want the lowest dose and the longest pause between dosages to maintain remission from depression. Everything I've mentioned so far comes from those FDA trials I mentioned. This is the ideal and the standard dosing protocol. But these original trials only measured patient outcomes for up to 8 weeks, and a lot happens after that when you take Spravato. So what happens when people take Spravato for more than 8 weeks? What do we know? And what about people in the real world that are taking Spravato right now outside of those rigid, sanitized clinical trials? How much do we know about what actually works here? Well, I've got some good news. We actually know a lot. Since being approved by the FDA in 2019, Spravato has been administered to over 140,000 patients worldwide. Wow, it's a lot of people with depression using Spravato. And this is super valuable real-world evidence on the actual experiences of real people that use Spravato. This real-world data is so helpful because it enables us to know what kinds of patients do better with what kinds of Spravato treatment plans and dosing protocols. So let's start looking at some of this real-world data. one study that was published in Spain in March 2025. It's called Integrate, and they tracked 189 Spravato patients that had treatment-resistant depression. It concluded that 28% of patients experienced improvements within 24 hours. Wow. 80% of patients achieved a clinical response or remission within the first 4 weeks of induction. And that by 9 weeks, 90% of people were no longer experiencing depression. Real people. Another really important piece of real-world data to know about is the expert opinion given by something called the Delphi panel on Spravato. So in a nutshell, a Delphi panel is the name given to a group of the world's most respected experts that come together to reach a consensus decision between them about a very specific medical issue. So there was one Delphi panel that got together to talk about Spravato and how long people should take it for. And they agreed that the minimum duration of Spravato treatment should be 6 months for patients with treatment-resistant depression. The minimum, 6 months. Another really important research study I want to tell you about is called SUSTAIN-3. It was a very large study. A lot of patients were tracked, and they were tracked over a long period of time. SUSTAIN-3 study focused on the long-term maintenance phase of Spravato. How long do people take it for? Showed that by changing the dosage and frequency of treatment, individual patients, particularly when you were tracking their depression scores, were able to find the optimum amount of time and dosage protocols to make sure that their depression didn't come back. Another way of putting this, it demonstrates that by continuing treatment with Spravato, the chance of relapsing back into depression was significantly reduced compared to a placebo over many years. And it found that on average, people take Spravato between 3.5 to 4 years. It also found that the maximum time that some patients were taking Spravato was 7 years. One more question I want to ask here is, what kinds of people need to take Spravato for longer or to have their dosing scheduled more frequently? And looking at all the literature, it seems that there's 3 specific factors that are really important here. The first one, for patients that have complex trauma, post-traumatic stress disorder, it tends to benefit a patient in these circumstances when they use Spravato for a longer period of time, just because of the psychological complexity of having these trauma conditions. Second factor that we found, individuals with a history of recurrent depressive episodes. So that means when they have multiple experiences with depression, again and again, not just one episode. Plus, if they have experienced a really acute, very difficult period of depression lasting longer with more symptoms of depression or suicidality, they tend to benefit from staying on Spravato longer in order for their depression not to come back. And then the third piece of data that we found, the people with other comorbid psychiatric conditions, particularly anxiety disorders, they benefit from staying on Spravato longer so that their depression doesn't come back. However, there's not yet a really clear maximum duration or a really magical, simple way of saying how long everyone must stay on it for. Everyone's different. One other thing I want you to keep in mind, the FDA has only approved so far Spravato being prescribed to people with treatment-resistant depression or major depressive disorder with suicidality. Both of these are really significant depressive disorders, and what that means is that many people benefit from staying on Spravato longer rather than coming off. That's what the research shows for these 2 more severe types of depression. And ultimately, the decision to discontinue Spravato, well, that gets made as a collaborative decision between the patient and the clinician, and you weigh up the pros and cons of relapse risk against factors like the time commitment and the financial cost of using Spravato. Ultimately, every patient responds differently, of course, yeah. There's no single timeline for Spravato that everyone has to follow. Working collaboratively is crucial to get the right treatment plan and the right dosing schedule for you. But we know enough about Spravato now. It's safe, effective, and durable over time for helping people with depression. And the exciting thing to me is this is just the beginning, because we expect in the coming years, Spravato will become accessible to patients with additional forms of depression as the FDA continues to broaden its approval indications for Spravato. And if you want to stay up to date about all of these news coming down the pipeline about Spravato, keep coming back here to our YouTube channel at Marpa Minds, and also check out our website at marpaminds.com. Who are we, Marpa Minds? Well, we're a network of next generation mental health clinics delivering Spravato and ketamine treatment for patients with depression. And who am I? I'm David Drabkin. Nice to see you here. Feel free to leave your comments, and please remember, like our channel and subscribe so you can get our updates. Take care, everyone. Cheers for now.